Welcome to Your Health Matters. I'm your host, Temesia Tuicaumia, and tonight we have a very special guest who is from the Ministry of Health headquarters, and I'm going to let her introduce herself. Welcome.
Hi.
How are you?
I'm good.
How's the nervousness? All gone now?
Yeah, all
gone.
gone.
Ready to speak?
Yes.
Oh, well, please
Okay.
introduce yourself.
Okay, my name is Shawal, and I am based at Namosi House at Wellness Center, and I'm the National Mental Health Project Officer.
I spoke to Kelly last time, and I mentioned how big your team is up at the wellness team, the department.
Maybe for you it's big, but for
Oh,
us
for you,
it's
it's not that big
yeah.
because you're looking after the nation. Yes, it's a
Yes.
lot of work.
Yeah.
Yeah, so okay, that makes sense. Yeah, you might need a lot more people, eh, when you're
Yeah.
covering the whole of Fiji.
For us, I think in mental health we are
Yeah.
only two people.
Oh,
Yeah.
okay. Okay, so I didn't know that. I was looking at everyone in the room, so I thought that was your big team that looks after everything. So it's good to know. Well, Shawal, thank you so much for taking the time and coming in. Today we're covering mental health, and it's quite a tough topic because a lot of our people here in Fiji don't really like to mention and have that conversation. And there's one thing I learned new from you and your team was positive mental health.
Yes.
Would you mind sharing that with us?
So positive mental health is not just the absence of mental illness, but it is a person's overall psychological, emotional, and
Wow.
social well-being.
Yeah.
So it's basically you're able to manage stress. You're able to manage the
Yes.
daily responsibilities that you are given, and you bounce back through the challenges that you face.
Wow.
So probably if we say positive mental health,
Mental health.
that means if we're speaking about a kid in
Yes.
school, so he or she is able to cope up with the work with the support from the teachers and
Yes.
parents. And for a working person, that would be playing the role of a parent
Yeah.
and their workspace as well.
Yes.
So it's balance between both
All of that. Huh?
and using healthy coping mechanisms
Okay.
to balance out.
Oh, what are some healthy coping mechanisms? Do you mind sharing?
Yeah. When we speak about healthy coping mechanism, that means that you are choosing, everyone experiences some sort of
That's
stress
true.
or anything. So, but how we are able to cope up with that? So that
Yes.
would be like if you're stressed out, you can go out for work.
Yeah.
You can go out in the nature.
Yeah.
You can spend time with your loved ones. You can talk to someone.
Yes.
And if you don't have anyone, you can,
Yeah.
we have NGOs, we have other organizations that
Yeah,
have
there's
toll free.
faith-based organizations.
Yes.
Yeah.
So you can get involved with those things. And those are some of the healthy coping mechanisms.
After you said that, it reminds me of just like the word mental health. Like a lot of people, when they hear mental health, they just think, oh, something's wrong.
Yeah.
But mental health is the mind, it's covering that whole aspect. And so when you were saying positive mental health, I thought, wow, what a good way to change the narrative because
Yeah.
everybody, when they hear mental health, they think, oh, something's wrong, with them. Um, you spoke about those mechanisms and coping mechanisms, which is very cool. What's it like working in the community and receiving all this information from your divisions and having to break the stigma in our communities? What is it like for you from the Ministry of Health's perspective?
Okay. For the, I think if we are talking about the younger population, I think they are
Yeah.
coming out. They're
Yeah?
speaking about mental health, how they are facing some of the
Yeah.
issues, how they are coping with
Yeah.
it. But I think there's still that stigma
Yeah.
around mental health.
Yeah.
And even when people would like to reach out,
Yes.
there's a stigma around even if they reach out to people or if they say they're stressed out or in
Right.
depression. I think there's still that misconception.
Right.
But it's really when somebody is feeling down, you just need to be there. Just
Yes.
lend your ears.
Yes.
You really don't need to be a professional,
That
person.
reminds sometimes when you're like, you want to talk to someone and they want to give you all the answers. Then you're
yeah.
like, no, just listen to me.
All I want
Yeah.
is just listen to what I'm feeling.
Yeah,
that's
so
it.
true.
You don't have to give advices.
Yeah,
They're
just
just
sit there and
listening.
listen.
Yeah.
Yeah.
So that's something we encourage.
Okay.
if our family members or in our community,
Yes.
if you see someone who has been acting differently, like
Mm-mm.
they're not used to be like that
Yes.
before, they're sad,
Yes.
they're quiet.
Like a change of behavior.
Yes.
Like I mean, it's obvious, right?
Yeah.
But also, would you say, because we come from a Pacific country, right? And in Fiji, our Indo-Fijian community, the Itauke, our Kailoma community, and others, different, our culture somehow is very strong with each
Yes.
other. And so it's like, oh, that's none of our business. Don't talk about it,
Yeah.
But what's it like working in that space where you have to push people to break beyond their culture as well?
I think if we look at our Fijian setting, like
Yeah.
the Itoke population, it's one of the great thing I always think of, that is every Sundays they have a get together.
Oh,
So
good
that
point.
yeah. So that kind of, they have that conversations.
Yes.
They get to connect with the
Yeah.
family members. They
Yeah.
have that
They
group.
have that group.
But I think what I feel for the others
Yes.
is not that much.
Oh,
Even
that's a good. I never saw it that way.
Yeah. That's one good thing I really love about that
Yeah.
in the community, where everyone on Sunday, it's
Yes.
mandatory
Yeah.
to go to the
Everyone goes
church,
to church.
take
Go-
part in the
yeah.
activities, and just be
Yeah,
there, just
be
enjoy.
there, yeah.
Yeah.
Being surrounded. That's so cool. Because you don't have to really say a lot, right? You
Yeah.
can just be in there, but you're quiet, but you're receiving a lot.
You are involved in it.
Yes.
You feel that, oh, I am important.
Yes.
It's not that you're left out.
Yeah. Another question I have for you is, you talked about the younger generation open more to the awareness of mental health.
Yeah.
In Fiji, there's growing concerns as well, with the rising of suicide cases. I was talking to Kelly and Jeremiah from Lifeline Fiji. From your perspective, what do you think we need to do more? Whether it's our young children in school, and our high schoolers, maybe the youth, and also those that are between 25 and 45, and then our older generation. What are some things that you've noticed in these age groups that we really need to push out and stress to the public?
I think for the kids, if you're talking
Yes.
about the high
Yes.
school or the ones in the primary schools,
Yes.
I think in these, parents play a very important role.
Please say that one more time.
Parents play a very
Parents play an important role. That
role.
is so good to know.
Yeah.
Good. Yeah.
Because they are the ones who see their child every day.
They do. Yeah.
And even teachers also play a role, but
Right.
parents play the most important role.
Good.
Because at the end
Yeah.
of the day, the kids come home. You're able to see the change in their behavior.
Yes.
You're able to see what they are doing.
Yes.
So that I would say for the kids.
For
But
the
for the
children,
high
yeah?
schoolers,
Mhm.
I think it's parents, but it's also their ability to make right decisions.
Good.
And if you're in your right mindset,
Yes.
if you're doing, there's always a holistic approach.
Yes.
So making right decision is also part of it, no? And your peers,
Yes.
whom you are friends with. If
Your friends.
yeah.
There's a quote I like to say. It's show me your friends and I'll show you your future. And the same birds flock together.
Yeah.
So
Yeah, it's somewhat
those
like that.
choices will come because you're around certain
Yes.
groups. Huh?
But everyone experiences some feelings. There's always something happening with everyone.
Yeah.
So it's very important that the kids, the adults, they know how to identify when
Yes.
they're on the lower end.
Yes.
Because there's always going to be a up
Yeah.
and down. Everyone is on a
Life
roller
isn't
coaster
easy,
ride.
yeah.
So there's always up and down, but it's how you manage it, how
Good.
you're able to handle it,
Wow.
how you're able to reach out. When
Yeah.
there is a need, you reach out.
Reach out.
And it's very important to have at least one person so close to you that you're able to share anything.
Everything and anything.
Yeah.
Thank you so much. I hope you're enjoying our talk today on positive mental health. And if you're someone like me who's just heard the word positive next to the word mental health, now we know. So come back and make sure to learn more from our representative from Ministry of Health. We'll see you right after the break on Your Health Matters.
This program is brought to you by the Ministry of Health and Medical Services. shaping Fiji's health.
Welcome back to Your Health Matters. I'm your host, Temesia, and today I have a very special guest, Shawal, who works with Ministry of Health's headquarters right here in Suva. And we've just talked about the stigma and awareness. We talked a lot about um, our culture playing a role in that and having that stigma. But I think what's really cool about what you said was the Itauke community and how they have Sundays where they go to church, and that even is a safe space to go to. So thank you so much for opening it up a bit more clear for us. Now, we really wanted to talk about access and support for Ministry of Health, and I know you just mentioned how overwhelming it is to support everybody in Fiji, but there are services available, and there's also non-government organizations and faith-based organizations. So I'm going to stop talking and let you share.
Okay.
What are these support services available?
Okay, so we at headquarters, we also provide trainings for our health workers.
Yes.
So in the rural facilities or in any other facilities, we have MH CAP trainings that we do. So that's
MH is in mental health.
yeah.
Oh, cool.
That's mental health program.
Yes.
That's we have adopted it through WHO. So
Lovely.
it's for the
so the Ministry of Health really works closely with WHO and other bigger organizations that are around.
Yeah. So that booklet itself has the components of mental health and how you're able to diagnose.
Wow.
It just aids the health workers to
making sure all the health workers are
trained. They're trained and they are equipped with the skills to identify and to refer to the respected.
You just gave me a little worry of imagine if people aren't trained, like you mentioned. They're busy listening and they want to give advice too. So that's really good to know that all our health workers are being trained.
Because not all of the health workers are specialized into this field.
Right.
So just aiding them with this.
Yes. Just a little bit. Cushion them and then they direct them to the right people.
Yes. So the services, if we talk about it, so if anybody wants to access these services, they can go to their nearest health facility. And
when you say these health facilities, is this like the medical centers?
In the nursing stations. All the health facilities.
So even in the maritime areas, they're available.
Yes.
Oh,
so they can always. We also have outreach programs in which they.
I know. That's one of my favorite things to see.
Yeah.
But please mention that. It's really cool.
Yeah. So they also have outreach programs, and mental health is part of it.
Yeah.
So we also have subdivisional hospitals and divisional hospitals which has stress wards in it. So if there's somebody who needs that care, they can always be referred to stress ward, or they can just go to any of the nearest health facility.
Can I just ask you to mention that one more time to your camera? Because there's probably one person that's watching tonight that's like, oh my gosh, I need to go to that center today. If you can just let them know that it's free, right?
Yeah, it's free.
It's free.
So anyone who needs this support can directly go to the nearest health facility and they'll be able to help you out to further refer you to the need of
That's so good
services.
to know. Yeah. I mean, because a lot of people are just like, I have to go all the way to Suva and, but...
Yeah, so we do have other organizations that we work with.
Oh, okay.
For example, there is Empower Pacific. They provide...
is that the counseling service?
Yes, counseling services. So they provide this 24 hours toll-free line.
What?
They can always
just...
Yeah.
24/7?
Yes.
Wow.
So they can just give them a call and if they need to talk or anything, they can provide that. And we also have Lifeline that also has a toll-free line.
They're amazing, right? I spoke to Jerry who came with one of your representatives.
So there is services available, but it's just the need to reach out.
Yeah.
I think once they feel and
step one, right? Like breathe, call, or breathe and go.
And please don't be afraid that whatever you're discussing might be leaked out or would be shared with others. No, every information that you give to the healthcare worker or to the counselor, it's always confidential. So please, if you need to get these services, please
so important.
go ahead.
it can be such a traumatizing thing too, where you're like, I mean, and we come from Fiji, so like
Yeah.
every other person is our auntie
And
or uncle or
yeah.
cousin or married to our cousin or something. So sometimes you can be like, I don't want to go to the hospital. I saw, blah blah
Yeah.
blah's wife is the nurse, and so it's thank you for just
Yeah.
sharing it confidently that don't be scared.
Yeah.
Yeah,
If you feel that there is a need for
yeah.
support, reach out.
Reach out. Yeah,
Everyone around you would be,
yeah.
will be accommodating, will
They will
be
be.
able to help you
Yeah.
out. You don't have to suffer alone and in
Good.
silence. We have
Yeah.
the services. Please go ahead.
Come.
Yeah.
Yeah.
And we also have our social media platforms that we advocate for, and
Okay.
I would also like to bring this up. We also have World Mental Health Day that we mark on 10th October, but I
Nice.
know it's Fiji Day, so we
Yeah.
don't really focus on that.
Oh, wow. But it's good to know it's celebrated together.
Yes.
So World Mental
Mental
Health
Health
Day
Day.
is on the 10th of
October.
October.
Yeah. So we mark that every year
Okay.
in our
Yeah,
divisions.
maybe we should stress it out, right? To all the families, when you celebrate Fiji this year, make sure to celebrate mental health as well.
Yeah.
That's so good to know. I didn't know that.
Oh, we do mark.
Yeah.
There's also World Suicide Day that we mark. So that's on the
Fantastic.
10th of September. And from there, we have our awareness programs till the 10th of October, or till the day that we mark at our headquarters or the divisional teams, or even in our subdivisions, we also do
That's
that.
so good.
And sometimes we also do collaborative events with our partners, with our
Yes.
NGO partners.
They come in full
Yeah.
support. Shawal, I just had a question. You had mentioned that anyone is available to come for these services in the medical centers. Is there anything really you would like to stress for maybe moms and dads and guardians that maybe have children that are in their youth or high school or maybe younger and they're not too sure what's going on and maybe they're showing those signs you were talking about? Maybe they're dealing with anxiety or stress with schoolwork. Are they able to come together as a family to these services?
Yeah, but I think it's always up to the child if the child would want
Okay.
to have a private
Good
conversation.
to mention.
But if the family wants to be there
Yeah.
and the child is comfortable having the family as
yeah.
part of the conversation, but I think they also run a family consultation as well. So
Oh, okay. So families can come and
Yeah.
then sort it out if the child wants to be alone or have mom and dad around.
Yeah.
Wow. Well, thank you so much for sharing. We're going to go quickly to another break. I hope you've been enjoying this segment on Your Health Matters. It's been really, really, really educational. So we'll see you right after the break on Your Health Matters.
This program is brought to you by the Ministry of Health and Medical Services, shaping Fiji's health.
Welcome back to Your Health Matters. I'm your host, Temesia Tuicaumia, and tonight we have a very good friend. I actually should have mentioned that you and I were in a conference together
Yes.
for counselors for schools. And so I'm really grateful that you've come in today because you know what it's like in conferences. We talk to each other, but we don't really get to know each other.
Yes.
And so it's good that I can finally hear what you do and doesn't sound easy. This explains why you're very jolly, because you need to laugh too before you go back into the office.
Yeah.
So we've really mentioned about breaking the stigma and we talked about services that are available. And now for this last bit, I thought it would be really cool just to share with all our families at home everyday life. Sometimes we can have these conversations, but people are like, yeah, but tomorrow I might have an anxiety attack with my homework because I didn't finish it, and what do I do? And so would it be okay with you just to share some examples of everyday life habits that families today can start doing at home?
Okay, so there is not really much you have to do. It's just
Good.
simple,
Yeah,
things
simple.
that you
Yeah.
can do every day. That's like taking a walk,
Yeah.
at least a 30-minute walk with
Yeah.
your entire family. That
alone.
Yeah, that involves your family
Yes.
time as well as your health as well. So when you work, actually your body releases dopamine. That's the happy hormone that keeps
Okay.
your mood balanced.
Nice.
So that helps. And you know, you
How
need
about movies? Just checking for myself.
yeah, movies is also
Okay,
good
okay.
because you get to
Okay, I love
spend
movies,
time.
so I hope I'm
Yeah.
not stressing myself out.
Yeah, but not too much.
Not too much, not too much.
Yeah.
Everyone.
Screen time is very important as
Yeah.
well, the amount of time you
Spend on the screen, huh?
Yeah. And also hydrating yourself,
Good.
ensuring that you drink water. That also stabilizes your hormones.
Oh,
Yeah. And eating the right amount of food, ensuring that you eat the right
Yeah.
type of food as well.
yeah.
Because even the vegetables that we eat, the
Yes.
nutrients, it also nourishes our mind.
Good.
So that's what we can do. And for the children's, you know, homework is always a thing. It's
Yeah.
a hectic thing.
Oh my gosh.
So it's always time management.
I think I still have trauma from when I was in school.
I know we all
Finishing my
have.
homework. Like, oh my gosh, Master Prasad's gonna kill me.
I know.
Right?
Yeah.
Okay.
So it's always good to
Yeah.
have time management,
Good.
ensuring that you always have time
Yeah.
for everything.
Manage your time,
Time.
everyone at home. Make sure. Manage your time.
There's always time to play and all those
Yes.
things, but work
Good
is
to
work.
know.
Even for those working people,
Mm.
I know we always complain that we don't have time to do this and that,
Yeah.
but for things we love, we need to take out
We
time.
need to.
We need to,
Yeah.
because health is something you cannot just buy from anywhere. You
Yeah.
have to focus on yourself.
Wow. Can you say that one more time? You cannot
Buy those things.
Yeah.
So you just need to ensure that you look after yourself.
Mm.
You spend time with yourself. Sometimes being alone is also good.
Yeah. That's
You
me
you
a
can
lot
do
of the
you
time.
can go hiking.
Yes.
Those are the things you can do
Yes.
to have
To
a good
enjoy,
yeah,
yeah.
just small steps, but small steps, consistency is very important. You
Okay,
need to do it.
Consistency is
Yeah,
very
important.
key here. Good.
You need to develop those behaviors or those
Yes.
habits, and you will definitely eventually have that behavior
Yeah.
set up. So
Because it becomes a lifestyle, right?
Yeah.
After you do it a couple of times, I remember reading a book and it said it takes 21 days to change your habit. So if you start today, after 21 days, it becomes your lifestyle, right?
yes. So once you start with anything, you
Mm.
will definitely go far.
That's really good to know.
Yeah. And what else can I say? And meditation is another thing that we can do.
Yeah, that's
Yoga.
a really good one. Yeah, I had Dr. Krupali from
Yeah.
the Children's Hospital,
Yes.
and she was talking about how they have that services available. If you don't mind sharing what that's like.
Oh, so we have meditations that, you know,
Yeah.
since everyone has mobile phones, you
Yes.
have YouTube. You can always just search there.
Yes.
And that's simple
And do
meditation.
one of those
yeah.
sessions.
You can do it by your own self, just in
Yeah.
your room. You really
Yeah.
don't have to go out anywhere.
Anywhere.
And there's yoga if you need to
Yes.
do.
Yoga's very
Just
good.
stretching, that's also good.
Stretches,
Yeah.
Going to the gym, that I need to do.
You know,
Yeah.
we can also keep pets. They're also
Yes.
good. You get to spend time with pets.
Oh,
you
that's
look
a
after,
good one.
Yeah.
Yeah.
Some people like to keep plants. They
Yes.
look after them. They
Yes.
water them
Yeah.
daily.
I have a friend who literally just has a pot plant in
Yeah.
every space, anywhere she can find. She will put a pot plant. So it's really just your habits every day,
Yeah.
your hobbies that you enjoy, you can do. Thank you so much for sharing. That's really cool. We really appreciate it. Now, we're coming to closing, and I just wanted to give you some time. If there's anything that has been really like a red alert for the ministry during this time, and you've just been really wanting to push out as a campaign or an awareness for our public, if there's anything you'd like to mention, I just wanted to give you some time to really stress it out to the public.
I think we all know that drug is an issue right now.
Thank you.
But we also need to ensure
Good.
that where our children are, what they are doing, and really ensuring that who are the friends, and
Yes.
these things are very important. And you give time to your kids. You
Good.
always ask about how is your school,
Yes.
how the things going. Are
Yeah.
you worried about anything? Just
Yes.
simple things can always help.
Yes.
You really don't need to lecture them. You
That's
just need
it.
to listen.
Yes.
How their day went. Just
Yes.
10 to 15 minutes is good enough.
Good.
You really don't have to,
Thank you. Yeah.
and you don't have to scold them. You just need to politely ask them, how is
Yeah.
it going? Is
There's a
everything
time
fine?
and place for everything, right?
Yeah. So maybe that very simple. I know it sounds very simple,
Yes.
but if you look at the bigger impact it has, and even if we can have monitor your kids' mobile usage, what they are doing.
Good point.
If you want, you can have a parental control setup done so
Yes.
that you know what your kids are doing.
Yes.
Because I know cyberbullying is also coming up and a lot of things are
Raising.
happening. It's very important as a parent to ensure what your kids are doing. Also guardians as well, to ensure what your kids are doing.
Thank you.
That's all maybe for me.
Yeah. Well, thank you so much for sharing. Thank you for taking the time and coming in tonight. We really appreciate it. Well, I hope you've enjoyed our segment tonight on positive mental health. And if you're like me and that was the first time you've ever heard the word positive included in the word mental health, tonight's the night. So make sure to find more about the services that are available in your community too. So you can also reach out for help wherever you are. And also those helplines that are available 24/7. That's it for us tonight on Your Health Matters. I'm your host, Temesia Tuicaumia, and I'll see you next week, same time, right here on my TV.
This program is brought to you by the Ministry of Health and Medical Services, shaping Fiji's health.